Good morning, good morning, good morning. Hello, hello. Nice to see. Hello everyone that's joining. Welcome to Mobility Magic. Nice to see everyone logging in. Welcome for joining us on a Monday morning, 11:30. You know the drill. We're going to work on some mobility. Hi to everyone that's joining. Great to see you all. Today's session, we are going to concentrate on a question that I had in from a member in regards to respiration and can we work on some things that are going to help me improve my breathing. Well, the good news is I know how to do that, so we're going to work on that today. So normal rules apply. Foam roll would be really useful. If not, we're going to do some stretches and mobility work that we won't necessarily need those for, but we're going to do a little bit of neck work, a little bit of work around breathing, and obviously follow along if you can. If not, feel free to join in on the replay, which I'll post after the session on the Instagram live page. If you have any comments, feedback, if you would like us to cover anything, please do leave comments under the post that we post for the replay afterwards, and that's just going to allow us to help understand what we need to cover for you guys. And also if there's any feedback you have about the sessions as well, because we always want to make sure that we're helping you guys. So without further ado, let's get started today. As I said, today's session is going to be focused around improving our breath and breathing and working on a few new areas which we haven't covered before in our sessions. But based on a question by a member, we're going to concentrate on those for you today as well. So first thing we always do, let's do a check-in, a little bit of a feedback loop to see if we improve. So as we're based on breath, let's start there. Let's take a nice deep nasal breath into our diaphragm. You can put your hands on your hips if you need to. And I want you to imagine you're filling that canister. So stand up nice and tall. Obviously if you're at your desk, it would be better if you're standing, but if you're at your desk, that's completely fine. Nice deep breath into your belly. Breathe out. And if you don't quite know whether you're breathing diaphragmatically, if you don't know whether you're able to fill this canister this way into our belly, cover one nostril. I say this regularly, but cover one nostril and imagine you're pushing that belly button out. How does that feel? Does that feel tight in the chest as that air rises, as we fill that belly and then we rise up to the chest? Do you feel any discomfort in the low back? How does that feel to you? Just ask that question for yourself. Next thing I want you to do is take another breath. Let's close your eyes this time. Just stand still and just see if you shift from side to side, forward to back. Just find that balancing point. Let's take a nice deep breath in. And out. Just see how you feel. So the first thing we're going to do is we're going to do a little bit of myofascial release or just self-massage, just to kind of check in those areas. So I like to start myself around the collarbone. So let's start going left to right on me, right to left on yourself. Now what you're going to look for is the collarbone. If you can feel it, just slightly below where your neck finishes, we'll feel the bony bit in your collarbone. And we're going to feel just underneath that collarbone, just follow that ridge up. So you're just going to rub gently. Now if you feel any direct discomfort, straight away we know that there's some opportunity there for you. So we know that if there's discomfort, there could be an opportunity for you. And we're just going to rub slowly, not too much pressure, about 7 or an 8 out of 10 across, just to kind of feel that out. And if you're brave and you want to go a little bit deeper, feel free to. But again, as we will say, frequency trumps intensity. So if you need to do this more than a couple of times in a day, that's actually better than doing it once. And we obviously want to make sure we're not bruising ourselves. So again, we're going right to left on myself, left to right on yourself, and we're just filling all the way to the end. And then what we're going to do is we're going to work down towards where the pec attaches, so between where the armpit and the collarbone here finishes. We're just palpating, just kind of seeing how it feels. Not pressing hard, we're not trying to bruise ourselves, we're just feeling how the tissue feels. We're just doing a check-in, and then we're going to work back along towards the middle of the collarbone, okay, just to where the sternum starts. And we're going to go the other way. Now, as we do this, just check in and just see how that area felt as you did it. If there's any areas of real tenderness, A lot of people have it just where the collarbones attached just by the sternum. You may want to spend a little bit more time just kind of massaging and releasing those areas, because it's just going to allow that rib cage just to rise a little bit more. It's going to allow that those clavicles just to lift up a little bit as you breathe in. We're just working our way along. Again, I'm going left to right, you're going right to left, and we're just going to massage, or at least palpate, the area around where our pec attaches near the shoulder. And let's just see how that feels. So again, if you're at your desk in a workplace, this may not be completely appropriate for you to do, but do follow along later when you get home if you can. And if you don't care about what your colleague's thinking, carry on anyway. Let's just do it. So again, we checked both sides, we've palpated both. Next thing we want to do is we're actually going to work into the ribs now. So we've done the collarbones, we kind of see how they felt. This can be really good, just more of a localized release. And if it feels less tender than it did before, fantastic. But just do this frequently and it will obviously help. So the next thing we do is we're going to work down to the first rib. The second rib. So we're just working our way along in between each rib, and we're just slowly pushing into the rib. Now this can be really sore. You can use your thumb or finger, whichever works. This can be really sore for some people, because as you breathe into your chest, often this can get restricted if we're not breathing diaphragmatically. So we're working from right to left or left to right, just all the way along the rib, just working all the way across. Now this isn't the only thing we're going to do today, but it's good to introduce these kind of techniques to you guys, just so you know what to work on and how to release that chest and rib cage so you can increase that breathing. So we're just going to do 3 to 4 ribs on the left side, 3 to 4 on the right. You could do all of them if you wanted to. You can go all the way around your rib cage if you need to. But I'm just doing the first 3 to 4 ribs, and we're just kind of palpating in between each rib. That's the important thing. We're just getting that tissue to open up, as right now it's probably a little bit tight like this, and that's probably just preventing you really getting that deep breath diaphragmatically and then increasing your rib cage as you breathe in as well. So as I said, you could go around the rib cage. You could start to really get underneath the armpit as far as you can go, and that will really, really start to release those intercostals and the lats as well, and the serratus as well, as that attaches to the rib cage, and that can be really beneficial. So again, going from left to right, working down each rib, and then we're going to work around to the rib cage. So let's do one just to show you what that looks like. We've done the first 3 to 4 ribs. Now let's just pick one, and either use your finger or your thumb, and we're just going to start to work all the way around. And as you get towards under the armpit, the rib cage starts to point up a little bit. So you're just going to follow that as well, and then just see where that leads. Normally, if you have some restriction in the serratus, intercostals, even as you work more towards the back into the lat, this could be a really great way of increasing that overhead range of motion as well. So you get 2 for 1 on that one, so that's a bonus for you. So let's start on the other side now. We're working at the top of the rib cage, just below the collarbone. We're working along the rib, just feeling out, just seeing if there's any areas that feel really tender. So if you catch a spot that feels really, really tender, don't push too hard. 6 or a 7 out of 10. Let's just palpate that area. Let's just feel it out. Again, this is part of our check-in. This could be our feedback loop as well. We're just working that soft tissue out. We're just trying to help in the areas that we haven't focused on in these sessions before. So down to the 3rd rib, just working along, not going too fast, just seeing what feels good, what doesn't. And I'm a little bit tender. I did have a chest day a day or so ago, so I'm feeling a little bit sore in that area, but that's okay. We're going to palpate and see what works. So again, we've done 3 to 4 ribs on each side. We've done 1 around this side, so let's do 1 on this side. Doesn't matter which one you choose, but we want to pick one that's going to work all the way under the armpit, so probably about 5th or 6th in between. And let's just start working our way underneath and just following it up diagonally and see where we get to. We get a little bit more tender underneath the armpit. That's completely normal, because often serratus gets a little bit jacked up in this area. And you can either raise your arm up or down, whichever works for you, just to work back, and then just work your way back into the middle. So again, 3 to 4 ribs. You could do your whole rib cage. Now what we want to do is we want to reassess how we feel to see if that works for you, okay? So let's repeat the same process we did at the start. Let's take a nice deep breath in as well. So nice deep breath in. First of all, filling this base of our canister, this belly breath, and let's just fill the top third as well. So, and let's see if that feels any better. Does that feel any better for you? Feels better for me. So take a few more breaths. Let's do 3 more. Let's put our hands on our hips, just around where our belly, in line with our belly button. And then take that top third into your chest. Now, just reassess, just see how you feel. Mine already feels a lot better. I'm able to expand a little bit more. You can only imagine what it would feel like if you did that on a regular basis, and if you did it frequently with less intensity. So now let's move on to a localized neck stretch. We can do scalene and the SCM. So we're going to pin our tissue down just around where we had our fingers for the collarbone tissue work. So you want to find that right collarbone or left collarbone, depending on which round you're viewing this, and we're just going to pin down that tissue. Now we've done this one before, and I want you to imagine you're painting a box with your nose. So we're going to have a slight tilt of the head, so we're tilting away from the collarbone, slightly back, and then we're going to paint a box or a square with our nose. So we're going straight up, keeping that tension even into our jaw, into our ears. It's really good to unlock even the ear canal as well. We're going up, we're tracing across to that top corner, keeping that angle of the head, which often people lose, coming down to the bottom right, and then we're going to paint to the left hand side. So we're just tracing that box, and we're not going too quickly. And if you want to increase the range, make sure you move with a breath. And for any of you that regularly get blocked ears, and this happens a lot, or ear infection and so on, or even sinus and congestion, pressure effects, if you're on a plane or whatever, this is really effective to unlock that ear canal. As you probably noticed already, there's a nice deep stretch here. So you can even breathe nice and deep. And if you want to take it one step further, you can even bring that arm down behind your back, but I'm just going to keep it here for now. If you breathe in these top corners, as I'm saying, you find that that ear canal can help repressurize a little bit too. So let's just shake that off. Let's just see how that feels. See if our breath's improving that one side. Feels a little bit better, and even my neck feels a little bit looser. So that's one of my favorites. So same thing again. Let's take our other hand this time, pin down that tissue. We're going to make sure we're just dragging it away from the collarbone, so we're biasing it down. We're going to lean our head away from where we're pinning down, and then we're going to paint that box with our nose. So we're leaning, turning, painting that box to come across. Trying to keep that angle at all times, just keep the tension on. Just drawing that square with the nose. You can even go the other way. Now, if you'd like a little bonus of this one, you can even include a little bit of jaw movement, and that will actually help loosen up that neck as well. So reset your position. Going to turn our head, lift that nose up, take a nice deep breath in, move that jaw as you breathe out, and then move into the next stretch. Bit of jaw movement just to aid the stretch. We're just going to do a gentle roll of the shoulders just to reset our position. And now we've done a little bit of a neck stretch. We've done a little bit of a localized loosening of the tissue in the collarbone and the ribs. And we're going to just check in one more time. So again, feedback loop's always going to help you assess whether these stretches, these mobilizations are going to be effective for you during your day, and whether these are things you can do more often or whether you just don't do them at all in your program. So let's just do a nice deep breath again. And as you breathe out, I want you to make sure that you're pulling your shoulder blades back and down behind you. See how that feedback from your body feels. See if your breathing's improved. We're now going to move a little bit more down to the floor because we're going to work on your intercostals, your serratus, your lats, and so on. A little bit of pec as well because that's going to help improve breathing. So grab your foam roller if you have one. If you don't, we can modify this to have a bit more stretch. But we're going to start by laying across the foam roller with our arm outstretched. So try and get myself so I can fit on the screen. But we're going to lay roughly in the corner of where our arm and our armpit kind of attach to our side, or where you feel most tender with a little bit of downward pressure, because a lot of people get bunged up in this area. It's a big junction point, have a lot of muscles that kind of meet in this area. And we're just going to lean into this area for a minute and take some nice deep breaths in. So deep breath in, breathe out, deep breath in. As we sink down, we're breathing out. So deep breath in, and as you breathe out, just sinking down. You should find that as you breathe out and you kind of relax in that position, the tension will go off these muscles. As I say, it's a big junction point for a lot of muscles in this area. So another way we can do this is if you don't quite feel the pressure, bring your arm up, use it as a rudder in this area. And we can also use our knee to kind of help take that tension into that area, that weight, backs and forwards. Now, we're going to move up just a little bit, or down I should say, moving up the foam roller, and this will then work into that next area. So if you had any tenderness that worked its way underneath the ribs in this area when we did our palpation earlier, this is a good and effective way of opening that up. So hand above you, use it as a rudder as we gently kind of rock backwards and forwards. You can even reach overhead, bring that head down, and then just breathe nice and deep. And then let's just move up again into that next area. And again, if this feels super tender, just take your time with it. Nice deep breaths. So a nice deep breath in. Reach overhead. This is going to help you work into that lat a little bit as you kind of rock backwards and forwards. So take your time with this one. We're going to flip to the other side and then we'll come back again because I feel like we're going to need to do this twice just to cover it off. So again, outstretched, corner where the arm meets the side of the body, into that corner. We're going to start nice and high up and we're going to reach over and we're just going to add a little bit of weight to the area and a little bit down pressure. So while you're in that position, once you kind of find that spot that feels a little bit tight, a little bit caught up, let's take a couple breaths. Nice deep breath in. And out. Deeper breath in. And out. And if you want to add a little bit more of a stretch, you can even creep your hand across the floor a little bit to add a little bit of stretch in that area. We can start to use our arm as that rudder as we come backwards and forwards across that foam roller, teasing out that tissue, trying to get rid of that tenderness when we're working at that kind of 6 or 7 out of 10 in terms of pressure. We don't want to have it too intense because then we'll really put the body into kind of fight or flight mode and it won't relax and let us release that tissue. So reaching back, going to move down the foam roller a little bit, and find that next spot that feels tender as we're working more towards the hip. So we're working kind of superior to inferior, proximal to distal as we move down, and we're just using that arm as a rudder. So whichever variation works for you, whether it's a reach across and we kind of swing you around, or you stay nice and tall and you kind of rock backwards and forwards, that is completely fine, okay? Now let's just work our way down just a little bit. And let's find that next area. Okay, so now let's switch back again. We're going to go through that one more time on each side. because this can, if you get this right, this can unlock so much for you in terms of overhead range of motion. So do a check-in if you haven't already, just to check how you feel. We've covered some of this before in other sessions, but slightly different application today, slightly different feedback loop, slightly different way of looking at the reason you would do this. So a little bit downward pressure with the left arm if you are laying on your left side like me, a little bit of pressure on the right side if you're on your right side opposite to me. We're pushing our arm into the floor first, and then we're just relaxing. So nice deep breath in, relax into that tissue, sink down to the foam roller. On the next breath, we're going to push our arm actively into the floor, and then relax that tissue, rocking backwards and forwards. Again, use your hand as a rudder if you need to. We can have it on the back of your arm if you want to open up in a slightly different way. Just support your head. Just put your hand on the back of your head, or you can reach up as tall as you can, or even reaching over the foam roller to get a bit more of a stretch. And we're just going to work into another area a little bit lower. So pick 3 positions on this one. Work 3 positions, and then switch back, work 3 positions, and so on and so forth. Just so you're not doing too much intensity on the one side. And then we're just going to rock a little bit, just to kind of help loosen up that rib cage a little bit into those that serratus. So let's just rock back to the other side. Let's work again, same thing. So reminder just to go slow, make sure you're breathing nice and deep, breathing in and going deeper on the out breath so that you're not creating tension in your body. The more you can relax, the better. This can be a really intense stretch for a lot of people. So gonna lay on this side. You can reach your arm out, push your arm down as we did before, and then we take a nice deep breath in, sink into the foam roller on the out breath. On the in breath on the next one, we're pushing into the floor. Use that hand as a rudder if you need to add a little bit of steering and rocking backwards and forwards. Reaching as tall as you can. You could even sweep around as I reach up and over. You can even stretch to the back wall if that's more effective for you. We can reach or put our hand on the back of our head if that works. Let's pick another position and let's make sure we're breathing, sinking into the foam roller. And let's use our hands as the rudder as we do some rotations. Let's reach forward and up and over. And let's just do a check-in. So now we've worked some of the soft tissue out across our rib cage and our chest. We've worked a little bit the serratus, a little bit the intercostals, and into the lat as well as we turn over. We should actually have increased our range of motion a little bit in our shoulders too. And you should feel a little bit better with your breathing. So the last thing we want to do is just open up that breathing in an active position, which is going to work for us. So we do it as a passive position, I should say. So we're actually going to lay on top of a foam roller. So normally I like to use a small ball, like an exercise ball, and that could be way more effective. So something a bit more like this would work. But if you just have a foam roller, that's okay too. So you've probably seen me do this before, but we're going to pick a side of our abdomen just to kind of help loosen up that those organs as well. And we're just going to rest on top of the foam roller. So pick a side. Let's say we're splitting our body into 2. I'm on my left side, so I'm to the left of my belly button, just between my belly button and my hip. I'm not resting on my hip, but I'm on the tissue surrounding it. And all we're going to do is we're just going to take nice deep belly breaths. So we're going to do 3 to 4. And as we breathe out, we're just sinking down into that foam roller, letting our body relax. Really concentrating on breathing into that belly. to be really good just to decompress that back as well. So we've done 4. So now let's just take one more, but we're going to fill our abdomen and we're going to breathe into our chest like we did at the very, very start of the movement. So nice deep breath in, all the way up to the chest. Nice deep breath out. Hands up, support ourselves, rock back. Let's move around. I'm going to face more towards you this time so you can see another angle. And again, placing the foam roller not on our hip, but just slightly above it, a slight angle on the right hand side of our belly button this time, just resting our body weight into it. And if you can't quite manage to, because you have a back issue or any other issue going on that prevents you from doing this, you need a little bit more support, just graduate yourself by using some yoga bricks as well. They also work. So again, tension in this area, take a nice deep breath in to our abdomen, and breathing out, really focusing on that breath. And again, as we breathe out, we're just sinking into that tissue, really start to open up. And if you want to take it a step further and you don't have any lower back issues, and obviously you don't want any, but if you don't have any contraindications, you can even lift yourself up with your elbows a little bit to add a little more of a stretch there. Now, last one, we're going to take a nice deep breath in to the abdomen, and we're then going to raise the air a little bit more into our chest, the area we've been working together on. So let's do one more. And let's see how we feel. So let's rock up onto our heels. Let's stand up. Let's do a little bit of a check-in and just see how we feel. So nice deep breaths into the belly. Really important that we do a check-in. You should, hopefully, feel a little bit better in these nice deep breaths that we're going to take. So hands on your hips again, if you need to. If you need to plug one nose to get that more control over your diaphragmatic breathing, that's completely fine. And let's just take 4 breaths into our belly first. And then the next breath, we're going to go belly into halfway up, just below our rib cage. Let's do one more. And let's just do one more. We're going to fill the chest all the way up, work on filling all this tissue that we opened up earlier. And as you breathe out, let's pull the shoulder blades behind us and down. So we're just pulling down this way. Excellent. So there you have it. We've done a session on trying to increase your capacity for breathing, working on those areas that kind of get a little bit stuck. In future, I'm going to concentrate a little bit more on opening up the chest a little bit, because that's an area we didn't get time to cover, but will definitely help increase those ranges of motion and also the ability for your lungs to fully inflate, which is perfect for our application. So again, if you have any comments, any questions, anything that you'd like to add, anything you'd like us to cover in the forthcoming sessions in the next few weeks, we're going to post this video to the Instagram live feeds, and you can always comment on that, and that's the best way to get it, because unfortunately we lose all the comments after we finish these sessions. So feel free to leave feedback, and also message me directly if you have any questions you would like to ask, because we're here to help you. So next week's session, same time, 11:30, it's the same every week. Love to work with you guys and obviously help you with your mobility. So yeah, without further ado, thanks so much. It's always my pleasure to serve you guys, and we'll see you next week, same time, 11:30. Have a great week, and see you soon.